I think that socially and culturally is accepted that women are gonna stay up all night, feeding the baby, change the baby, or waking up multiple times during the night. And the next day, they're just gonna function as if nothing happened. Culturally is accepted this way, but we know that physiologically, that's not what is happening.
Ladies and gentlemen, welcome to the Crab and the Cross podcast. I'm your host, Mary Rose, and my guest today is Dr. Carleara Weiss. She is a professor, researcher, and clinician in the field of sleep science, and we have a fascinating conversation about the science of sleep, the cognitive benefits and detriments to getting enough sleep, the gender differences when it comes to sleep, and so much more. I know it might seem a little off-brand to be talking to a sleep scientist, since most of my interviews have been about faith and the spiritual life, but first of all, it's the Crab and the Cross, so nothing is off-brand. Second of all, Dr. Weiss is also a practicing Catholic, and we have a really interesting conversation towards the end about some of the moral and spiritual implications regarding sleep, including what Scripture has to say or reveals to us about sleep, so definitely stick around towards the end. I think my dream behind having a podcast is just having the ability to sit at the feet of somebody who is way more educated than myself and to just ask them one question after another. And so this dream was totally fulfilled with Dr. Weiss because she is a wealth of knowledge. And I'm super interested in health sciences, whether it's sleep or diet or exercise. So it was so fun to just have her unpack some of her knowledge. So if you enjoyed this conversation, make sure you are subscribed to the podcast. Many listeners are listening without subscribing. Second of all, make sure you're following me on Instagram or Twitter, or subscribe to my YouTube channel. And if you are feeling generous, please leave me a written review on Apple Podcasts. And now here is my conversation with Dr. Carleara Weiss. Dr. Carleara Weiss has over 15 years of experience as an adult geriatric nurse with a master's in science of healthcare and a PhD in nursing, focusing on behavioral sleep medicine and circadian rhythms. Originally from Brazil, Dr. Weiss earned a bachelor's in nursing science, bachelor's in education, and completed medical surgical training and a master's degree at the Federal Fluminense University, Niterói, Rio de Janeiro. After 8 years as assistant professor and clinician assisting adults and elderly patients in hospitals, nursing homes, hospices, and private practices, Dr. Weiss moved to the United States, where she earned a PhD and post-doctoral training in sleep and circadian rhythms at the State University of New York at Buffalo. Dr. Weiss is a member of the American Academy of Sleep Medicine, Sleep Research Society, and participates in professional developmental workshops, including cognitive behavioral therapy for insomnia and circadian rhythms, sleep disorders, and clinical studies. Dr. Weiss, thank you so much for joining me today.
Thanks so much for having me, Mary Rose. I'm so happy to be here.
I'm so excited to talk to you. I'm very passionate about the topic of sleep. I'm always trying to understand myself in this regard. It seems like I remember maybe 15 years ago, I had a friend sleep over and she's like, yeah, I just close my eyes and fall asleep at night. It takes about 5 minutes. And I was like, wait, there are people like that who just fall asleep when they want to. Like, I have to have the whole routine, and then sometimes I'll even lay in bed for 30, 45 minutes, just kind of like hoping to drift off. And so I'm very curious to find out some of the biology behind these sleep differences.
Yes, I'm happy to share that.
So you started out in a nursing career. How did you decide to pivot towards focusing on sleep?
So as a nurse, my clinical approach to treat sleep disorders was medication, right? So if a patient is not sleeping well, so let's see what medication can we get for this patient to make sure that they sleep better. And knowing that sleep is an important component for recovery. So if the patient's not sleeping well, something is wrong.
Right.
You need to make sure that the patient's going to sleep. But as I progress into my career from clinical to master's to PhD, I realized that there is more that we can do than rather than giving a medication. And sometimes the medication is just knocking somebody out, not really making them sleep.
Mm-hmm.
So that was an important transition for me. And also learning how sleep disturbances are usually the first sign that something else is wrong.
Oh, really?
Yes. So, for example, my area of research is sleep and cognition. So dementia, memory impairment. So at least 10 years before somebody has an Alzheimer's diagnosis, they're going to be having sleep disturbances, right?
Wow, I had no idea.
Yes. Yeah. So that's why it's important for me as a scientist and
Mm-hmm.
as a nurse as well
Mm-hmm.
to not just give a medication, but investigate what is happening there and
Right.
why the person is not sleeping well and how we can help the person to actually fall asleep and stay asleep, not just knocking them out with medication.
Right. Okay. So initially you were giving them, was it things like Ambien or those other like sleep medications that just totally wipe you out?
Yes, yes, some benzodiazepines,
Yeah.
the classic benzodiazepines, and making sure that they would sleep, quote
Right.
unquote. And then what I noticed with especially with the older adults is that the level of memory impairment and confusion, and even sometimes delirium,
Mhm.
would increase with those medications. So it was
Wow.
really not, they were not sleeping properly
Hmm.
because sleep gives the opportunity for the brain to recover from all this damages and accumulations that we have during the day, right?
Right.
And then if we're sleeping well, we're going to have a sharp brain the next day, sharp memory. And I was not seeing that with my older patients. So I have
Wow.
to investigate that.
Wow. When you say like damages that happen during the day, what is that referring to?
So we are referring mostly to inflammation
Okay.
and to neurodegeneration also.
Hmm.
So as we grow older, we become more exposed to um, more at risk to have accumulation of some molecules in the brain that are causing neurodegeneration, such as beta
Wow.
amyloids.
Okay.
Beta amyloid is the famous one, but we have many others with very different biochemistry behind them. But we can call those uh, biomarkers for neurodegeneration, right? So our body comes with this protective system that's called lymphatic system,
Hmm.
happens in the brain that only works when we are sleeping. I
Wow.
So like 95% of the lymphatic function happens during sleep.
Wow.
So if we're sleeping well, we can have, our brain has the mechanism to clean out all these molecules that cause brain degeneration. And if you're not, we're accumulating that over time. So um, we are more likely to have Parkinson's disease, Alzheimer's, or
Wow.
other types of dementia.
Wow. So can this even start happening at a young age or is it mostly in elderly patients?
That actually starts at a young age. So some studies are looking at 45 years old,
Mhm.
others are looking at 50 years old, and then the person is not going to have dementia until they are 70.
Okay.
So
Wow.
yes. and,
Wow.
and that's only one aspect of
Hmm.
the how sleep is important. It
Right.
always also affects hormone regulation,
Okay.
our immune function, and so many others, right?
Right. Yeah, because I noticed like when I don't get a good night's sleep, I mean, obviously you wake up tired, but I also feel nauseous and I feel like I can't like not even just focus mentally, but focus my vision, you know?
Yes, yes. So glucose and how we regulate hunger and satisfaction, all those hormones are also affected by sleep. So it's not a coincidence, for example, if somebody don't sleep well and the next day they're craving fast food,
Hmm.
right? Because there's dysregulation the hormone levels to tell the brain that they are actually satisfied with the food and that they don't need more food.
Really?
Yes.
Wow.
Yeah. So, for example, if you look at night shift workers in diabetes and being overweight, that happens, that has a high incidence among this population, it's actually because they're not sleeping well and they're not sleeping at the time that they're supposed to be sleeping. And then the hormones are out of sync.
Wow. Is there any way around that for people who do work? You know, I mean, you were a nurse, like obviously we need overnight shift nurses. Is there any way around that?
Yes, yes. That's why behavioral sleep medicine is so important instead of just giving medication,
Hmm.
because we can adjust their sleep and wake schedule and have some interventions, for example, with bright light therapy at a certain time of the day to help their circadian rhythm works in the best way to compensate for that night they are doing work.
Wow. So are these like special lamps, or is it just a use of, you know, regular indoor light?
Those are special lamps,
Okay,
and we
okay.
can also use glasses as well.
Okay. Yeah, because I've seen the red light therapy is becoming really popular now, and some people are saying they look at the red light in the morning and then they wear the blue blockers at night, and it, you know, I wondered if that's just sort of a marketing thing or if it actually works.
There's a lot of studies for that. And actually, for my PhD project, my project was using bright light therapy
Okay.
for older adults that had lung cancer.
Oh.
And they had severe cases of insomnia, and their biological clock is just not working properly. So I used bright light therapy to resynchronize that and help them sleeping better. But then the other outcomes were better quality of life, better mood, better memory, participating more with the family activities. So it's a very impactful tool for sleep and circadian rhythms.
Yeah. So when you are doing those studies on patients, how are you measuring I guess their biomarkers to see, I mean, obviously they can report like, oh, I feel more rested, but like what biomarkers are you measuring to see like how it's actually working?
So I collect blood from them
Okay.
and I look at the serum levels of those biomarkers. And we have other non-invasive ways to look at those biomarkers too, and also overall reports. So we can ask the patients, for example, to fill out sleep diaries throughout the study, so we can monitor how the sleep changes happen before the intervention, during and after the intervention. We also have surveys and computer-based tests that we can do before and after the intervention. And lately, we've been using actigraphy and Fitbit.
Oh,
So
okay.
we can monitor the patient every day and see how the progress is going for them.
Okay. Wow. So how long would it take for patients to regulate them? Like how long did you have to do the interventions, or is it just a permanent, you know, for the rest of their life?
It really depends on what is the target that we have. So for bright light therapy, the minimum that we need is 6 weeks.
Okay, wow.
The minimum is 6 weeks. So to have that with a person that, for example, lives in New York, like I live, that we
Mhm.
have great days for months,
Yeah.
this person's probably going to need more during the winter, right?
Wow.
So there's all those considerations and other interventions, such as cognitive behavioral therapy, the minimum also would be around 6 to 10 weeks. Some people may need more than that, but we can work with that minimum.
Okay. Yeah, because I think a lot of people think like, okay, if I just kind of get a good night's sleep a few nights in a row, I'll get back on track. But it sounds like it needs a lot more time than that.
Yes, yes, and that's the challenge between prescribing medication and doing behavioral sleep therapy,
Yeah.
because the medication, you see the effect in the first night, um, but with behavioral changes, depends so much in our willpower to desire to do those changes,
Yeah.
but the effects last longer than a medication, and they have fewer side effects than taking a medication, and you don't become dependable on taking a pill to sleep better.
Right, right. So is that then where the cognitive behavioral therapy comes in, is kind of getting them to will to rearrange their life to make these changes?
Yes, and then we also can work to understand their behavior and see which behavior we can actually change,
Mm.
because I cannot just say these are the recommendations for you to sleep better.
Mm-hmm.
This, and this. And they're gonna tell me, well, this one doesn't really work for me,
Mm-hmm.
but this one can work. So
Yeah.
let's focus on this one that can work and see how that goes.
Yeah. Yeah, because I'm sure everybody has seen those lists, 8 tips to get a great night's sleep or whatnot. And I mean, I know for myself too, like it all makes sense to me, have the nighttime routine, don't use the phone, et
Yes.
cetera, et cetera. But then when it kind of comes down to implementing it, you just sort of say, well, I don't know, some things aren't a big deal. Well, actually, one thing I want to ask you about is when I see those lists of like sleep tips, a lot of times they say don't eat too close to bedtime.
Mm-hmm.
But for me, I notice like, let's say I cut off eating at like 8 o'clock or something, I'll get in bed at like 11 and I'm hungry. And then I can't fall asleep until I eat something. So I know you mentioned like there's this glucose effect like with sleep. Is it, I don't know, in your experience, does it hold true that like, you really shouldn't eat too close to bedtime, or is it very dependent upon the person?
Is true that we should not eat with, close to bedtime, but we need to use this behavioral sleep approach to understand what it close means to you.
Okay.
So I cannot say that you should stop eating after 8 p.m. If you go to bed at 11 or midnight,
Mm-hmm.
that's not too close to bedtime. You can
Okay.
you can eat a little later than that.
Okay.
So that's the trick. We need to understand the patient and really work to tailor the intervention that we do that is best for them, for their schedule. So with that, it's not going to be a burden for them to make changes. It's going to
Mm-hmm.
just feel natural. For
Right. Right. Yeah. So in your work now, are you conducting research still, or are you mainly seeing clients like one on one?
I'm conducting studies most
Okay.
of the time and teaching as well.
Okay.
So yeah, so I'm now in a faculty position at the State University of New York here in Buffalo, and I have my research focus on that, um, looking at how the brain works with sleep deprivation or sleep disturbances, and how we can use sleep to prevent cognitive impairment and dementia.
Mm.
Right? So, with this research, I'm looking at older veterans right now, but my goal is to expand to a broad population. And I'm looking at veterans because with the stress and the training that they have, most of the research that we have around veterans says that cognitive impairment starts around 45 years old
Mm-hmm.
rather than 60. That would be the general population.
Yeah.
So they served our country and they did so many for us, and we have to do something to help them living better,
Right.
right? So that's why I'm looking at veterans at this time, but with the goal to expand into different populations of older adults, and also make sure that we include diverse sample because we have different social and economic impacts in sleep as well, right? So that's the goal. I'm working more. I'm focusing on research and teaching.
Okay. So with the veterans, I mean, do many of the ones you work with have, traumatic, PTSD or other traumatic experiences that also are affecting their quality of sleep?
Unfortunately, yes.
Wow.
Yeah, unfortunately, yes. They had those experience. I work with Vietnam veterans, so that is an unfortunate part of their work. And now, so many years later, we find ways to help them overcome those problems and hopefully sleep well so they can age well.
Yeah. I've heard that with at least some forms of Alzheimer's, there's like certain genes that are related to it. Do you find that if you can have these early sleep interventions that can almost like deactivate those genes, or is there a certain amount of determinism that's always going to be there?
So the way that I like to look at this approach with the genes for Alzheimer's disease and even with the biomarkers that we have for Alzheimer's disease is make a comparison with breast cancer, right? So we have breast cancer screening now that even if you don't have anybody in your family, you can request a breast cancer screening and check if you have the genes that would increase your risk to develop breast cancer. And then there is a list of interventions that we can do to prevent that from happening, right? So with Alzheimer's, although the research is very in the beginning stages right now, we hope to do the same thing.
Okay.
We hope that by looking at those biomarkers and even to the genetic markers early on, we can create interventions to help the brain recover and stay on a better state to prevent dementia from happening in the future.
Yeah. I mean, it's kind of wild to me that I mean, once you turn a certain age, you do the breast cancer screenings, you screen for colon cancer, other things like that, but there's no regular investigation into people's sleep. That's just considered like you take care of that and we'll do the like internal imaging or things like that.
Yes, it's something that me and some other colleagues, that's something that we want to change. We want to incorporate sleep in those categories for screening and then having interventions early on and prevent some other problems from happening.
Okay. Yeah. Okay, so let's get a little bit into the science of sleep. So you said that you studied the circadian rhythm. So can you first just explain what the circadian rhythm actually is?
Yes, so the circadian rhythm is this about 24-hour cycle that our body goes through, and it incorporates sleep and wakefulness. And everything that is associated with our body that needs to happen during wakefulness and everything that needs to happen during sleep. For example, we need to be alert during the day, and we need to have some hormone regulations that help us to stay awake during the day, like cortisol. And for sleeping, we rely on melatonin to help us understand when it's time to fall asleep. And also, because of melatonin increasing in the system, other hormones are going to be regulated to help with glucose rhythm or even with cell growth. So we have these differences in these 24-hour cycles that help us to stay awake and be functioning better during wakefulness and also fall asleep, but all the regulations that need to help happen during the sleep cycle as well.
Okay. So I assume like there's probably some point in the evening when everyone's melatonin is supposed to rise, and then some point in the morning where the cortisol is supposed to spike. Is there an ideal distance between like the time you want to go to bed and the time your melatonin is supposed to rise?
Yeah, so we start detecting melatonin about 16 hours after we wake up.
Okay.
So that'll be the initial level or tipping point that we can start detecting higher levels of melatonin in the blood. And ideally, we would start planning to go to sleep at a later time, right? So the peak for melatonin is around 3 a.m. So,
Oh, okay. Wow. So it's going up even as you're already asleep.
yes, yes. So, and then melatonin start dramatically going down and cortisol start going up.
Mhm.
So right in the morning, around 7 a.m. is when we see a dramatic change in cortisol levels going up. So they have this um, flip switch with
Uh-huh.
between them, and it's ideal that over the 24-hour cycle they keep doing this
Mhm.
without much intervention from the exterior. But that's the perfect scenario, right? Like
Right.
we know that our circadian rhythm, the biological clock, has influence from the environment also. So we need to adjust how we have our schedules and everything to help them work in the best way possible.
Right. So ideally, is it supposed to be that when melatonin is at its highest, cortisol's at its lowest, and vice versa, or are they not perfectly aligned in that way?
No, they should go, one is up, one is down. They
Yeah.
should go in that switch.
Okay. So then the patients that you are studying right now or in some of your PhD research, when it comes to, nighttime, what's going on with them? Is there melatonin low? Is there cortisol high? Is it both? Are there other biomarkers that you're noticing?
Yeah, so they do have high levels of cortisol
Mm-hmm.
during the night, and it can be because they have a chronic disease that is affecting their stress level, and then they become more anxious at night, and then the cortisol level goes higher. Uh, B, they have low melatonin because as we go older, our melatonin levels decrease
Oh,
naturally.
really? That seems
Yes.
that seems like the opposite of what you'd want to happen. I mean, is there any
Yeah.
like I don't know, evolutionary reason why you think that might happen?
Not exactly. It's just similar to other things like menopause that the
Okay.
hormones change because we're
Okay.
getting older, and that is not really other explanation other being older.
Okay.
Yeah. So yeah, so they have higher cortisol, lower melatonin levels, and pain, depression,
Hmm.
other things that also affect the sleep, or sometimes they just need to use the restroom more often during the night, and that disturbs the sleep as well.
Mm.
So we need to work with all those components to help them sleep.
Mm-hmm. Yeah, if somebody has to wait, just wakes up naturally to use the bathroom in the middle of the night, I mean, is there really a way around that, or do you just have to adjust when you consume water?
We can adjust when consume water, but we can also make some observations. For example, if they um, older adults or pregnant women, they have to go to the bathroom to they need to urinate during the night,
Right.
but it doesn't mean that they should be lying in bed for 30 minutes or 40
Okay.
minutes
Okay.
to fall asleep again,
Right.
right? So that's what we can work.
Okay.
How we can decrease that time that they are tossing and turning in bed before they fall asleep again.
Okay. That makes sense. And are you able to do you have people coming into a lab and they're hooked up to machines like all through the night and you're able to check their hormone levels through the night, or is it more just brain waves?
We can do that.
Yeah.
We can totally do that. My current approach is everything at home.
Okay. Okay.
So we can do this overnight sleep study at home. But what my preference is that we monitor the patient with minimal invasive approaches at the most for when they are at home. That's why using smartwatches like Fitbit that has a sleep component give me a good perspective of their sleep while they are at home. But of course, we can bring them to the lab. We can do some other assessments at home as well.
Okay. Yeah, because I always wondered that, like, if I were to have to go into, this medical facility and be hooked up to machines, I don't think I would sleep well at all. I feel like it would throw off the experiment.
Exactly. Happens with many people that you are in a different sleep environment. You have so many tubes and things hook up to you that you simply can't sleep.
Right. Then you're like, can I roll over? Am I gonna mess the whole thing up? Yeah.
Yes.
So you talked about circadian rhythm. Is everybody on the same circadian rhythm, or is there really a such thing as like a night person, morning person, or are night people just people who are all messed up?
No, we have morning person, we have evening person, we have people who are intermediate, that they're not really morning or really evening,
Mm-hmm.
and our circadian rhythm has those different changes too.
Mm-hmm. So does that mean that you're kind of boxed in to a certain extent? Like if you have this natural tendency, can you sway it the other way? Can you become more of a morning person if you're naturally more of a night or evening person?
Yes, we can do that with behavioral sleep medicine. We
Okay.
can adjust our biological clock to work on an earlier time or a later time
Okay.
with some changes in our behavior.
Wow. Um, have you noticed any differences between men and women when it comes to their sleep patterns?
Yes, so women and men have sex-based differences when it comes to sleep. So, for example, women, we have menstrual cycles,
Mm-hmm.
right? And then the differences in the hormones during the menstrual cycle affect our sleep. During the later phase of our menstrual cycle, when progesterone is higher, we're more likely to have insomnia and overall sleep disturbances because of a rise in our body temperature that is
Mm.
caused by progesterone. So, so PMS usually happens during that time too, and sleep difficulties are more likely to be observed during that time. And then with menopause, we have also a decline in progesterone, declining estrogen that affects the sleep too. So, and then comes hot flashes, all
Mm-hmm.
this that affect the sleep too. And overall, women spend more time doing a stage 3 sleep. That is a deep sleep stage with more memory consolidation.
Hmm.
So yeah, it's very,
Wow.
yeah. So that's very interesting. We tend to see those changes becoming more um um like easier to identify when women and men hit their 30s. So
Okay.
even though teenagers may experience PMS and all that, but if you compare to the male at the same time, at the same age, they still sleeping basically the same,
Mm-hmm.
but around 30 years old, that's when the difference become very, very intense.
Oh my gosh, that's so interesting. Um, so with women, yeah, we have these like temperature, drops and spikes. Should we be like just turning the AC on like when we're in that second half of our cycle, or is it mainly just a temperature regulation thing that can be easily solved?
Yeah, so the temperature regulation is driven by hormone.
Mm-hmm.
So there's a recommendation, especially for women in reproductive years,
Mm-hmm.
that they understand their menstrual cycle, see that something is out of sync with the menstrual cycle. If they have a short luteal phase, for example, if they have an ovulation in a period that happens less than 14 or 16 days, they should be checking that. So
Mm.
with some hormone supplementations, that usually is progesterone that we supplement, and
Okay.
helps them maintain a more stable menstrual cycle, so then they can adjust their sleep with less burden because the menstrual cycle is more stable, right?
Okay.
But
Okay.
of course, we can make some behavioral changes also. So
Okay.
sometimes I recommend, if you zip with a blanket, put your feet outside of the blanket. So it drops the temperature just a little bit
Yeah.
and you sleep better, right? Or
Yeah.
have the room temperature around 65. So it's not too cold, not too warm, and you can sleep better.
Huh. That's so interesting. But the goal though, I mean, I know with like people who track their cycles, like there's these certain temperature, drops that you look for. So the goal is not to have a completely like, I guess, homeostatic temperature. You still want some fluctuation if you're a woman, right?
Yes, fluctuation is normal and is desirable for women because we want to see those changes during ovulation and during luteal phase, right? And if they become pregnant, the temperature is going to continue to rise after the luteal phase. But the thing is that if the menstrual cycle is irregular, they're going to experience more sleep disturbances because there is a discrepancy in their hormones that drive the menstrual cycle.
Okay. Wow. So you mentioned too that we said women, they spend more time in stage 3 of sleep. So can you explain what the different stages of sleep are?
Yeah, so we have two big clusters of sleep. That is the non-REM sleep without rapid eye movement, and REM sleep with rapid eye movement. And during the non-REM sleep, we have three stages. Stage one, that is a very light sleep. And then stage one is almost like a transition between being awake and falling asleep. And sometimes we just move and wake up from that. Stage two is considered a more in-depth sleep. And stage three is the deep sleep stage. So during stage two, the way that we usually teach is that during this stage, we see dropping body temperature, dropping respiratory rate and cardiovascular rate, and just helping the body relax, have muscle relaxation, muscle repair happens in this time. Growth hormone is being more produced in this time. Immune function is also being restored in this stage. And then stage three, that is the deep sleep stage, is helping the brain recover more for memory consolidation, for emotional memory also in that stage. Right. And then the REM sleep stage is when we have intense brain activity that is almost similar to somebody being awake. Wow. Where we don't have any muscle or reaction during this stage, just the eyes that keeps moving with the eyes closed most of the time. But we have intense memory and learning consolidation during this stage as well.
And which of the stages are we actually dreaming during, or are we dreaming during all of them?
So mostly during REM sleep.
Okay.
But some research, more recent research, shows that during stage three, we can also be dreaming.
Okay. So then with women who have given birth, like they have to get up multiple times throughout the night to feed the baby, possibly to change the baby. And of course, babies, I don't even know. We could talk about babies too. They probably have their own, some of them sleep really well. Others will not fall asleep. But how is it? I mean, are women like, is there, I don't know, cognitive health suffering a lot during this time? Or are there any like protective measures that the body kind of does to mitigate all of this sleep disturbance?
So there's some interesting research about this, right? So I think that socially and culturally is accepted that women are gonna stay up all night, feeding the baby, change the baby, or waking up multiple times during the night. And the next day, they're just gonna function as if nothing happened, right? Culturally is accepted this way, but we know that physiologically, that's not what is happening. They're just, their body is working to compensate for the sleep deprivation that they experience. And as I said, some research says that we have some hormone regulations that happen during postpartum that help women to overcome that. Uh, but there is a strong behavioral component to this, that women accept that they need to do this, and they just accommodate their schedule for doing that, for providing for their babies when the baby needs them.
Do you think that is more of a contemporary cultural notion, or I mean, I don't know if other time periods maybe the women were less expected to like bounce back or take care of the home while they're new mothers, but do you have any insight into that?
I have an insight from that, not from a scientific perspective,
Okay.
more from a cultural perspective. For example, for me coming from Brazil, we women are entitled 6 months of maternity leave.
Wow. Oh my
Month,
gosh.
yeah, 6 months of paid maternity leave,
Wow.
right? And I have colleagues that live in Europe, like Netherlands. They have 1 year of paid maternity leave.
Oh my goodness.
Right? So that is more aligned with the physiological change that they go through and how much it takes for the baby to be in a sleep schedule and then for the mom to adjust their sleep schedule, right?
Okay.
And here we have 6 weeks. If
Yeah, that's, I
yeah,
mean, you're lucky. You're lucky. I mean, maybe you get 6 weeks unpaid, but you know,
yes, six.
I was a
So
teacher, and like my sister was a teacher, and I mean, maybe 2 weeks, you can technically get,
yes, so like it's not that women are ready to go back; they have to go back.
Yeah,
Right? So
right.
they have to go back. So we are forcing women to work with sleep deprivation and to fight and find mechanisms to compensate for sleep deprivation, right? But that's very much a cultural perspective rather than a physiological perspective. Our physiology will catch up to that
Right,
eventually,
right,
but yeah.
right. What are the consequences of that? I mean, other than just being tired and not, being probably the most happy person, like what are some of the other consequences of, a woman who's postpartum, who's still regulating her sleep with her baby's sleep? Like, what are some of the consequences of her trying to function as she did, prior to that?
Yeah, so we have some immediate consequences. For example, um, they're more likely to get into a car accident.
Oh, wow.
Yeah, because the reflex is diminished, right? The reaction time is diminished. So they're more likely to have accidents. They have memory impairment that we usually say, oh, she has baby brain.
Mm-hmm.
We do have some changes that happen in the brain because of pregnancy, but being forgetful, doesn't mean that it's just a baby brain. You're not sleeping well to make memory consolidation or learning consolidation. So those things we can observe in women, but it's again like we have so many cultural perspectives that say that women need to go back and need to be sharp and need to keep the ball rolling.
Yeah.
And it's complicated because we expect them and we often say bounce back,
Right.
but they're not the same person. They should be giving grace and opportunity to adjust to their new life without that being a burden.
Right. Well, I mean, I wonder too, even though for like women who don't have like a professional job, they are stay-at-home moms, if they have 4 or 5 kids and then they have a newborn, it's probably tough even just to bounce back to the normal routine of taking care of the kids, taking care of the house and all of that.
Exactly. And some studies that look at a timeline for when they're going to be back into the pre-baby sleep stages, right? So it takes about 6 months for that, 6 months to a year.
Hmm.
And that's not accounting for working and being professional or business women. It's just telling
Yeah.
them physiologically it takes about 6 months to have your sleep to be the same as it was before the baby.
Yeah. Do women have a higher incidence of dementia and Alzheimer's?
Some studies show more women and some studies show more men.
Okay.
Depends on the age range that they use, and also depends on the ethnicity.
Mm.
So there's the data is a little has both sides, let's say like this. The data demonstrate both sides. Some data demonstrates more men, some data demonstrate more women.
Okay. Wow. Okay. Well, I just have one more question about sleep, and then I just want to spend a couple minutes at the end talking about kind of the Catholic and spiritual piece of all of this. But everybody wants the quick fix, the solution, the pill, and I see all of these supplements marketed, whether it's melatonin, whether it's what's that? The active ingredient in green tea, or one of the active ingredients in green tea, or
L-theanine, magnesium.
L-theanine, yeah, things like magnesium. I mean, is there any fix found in a bottle? Is there any supplement that you actually would use in your clinical practice, like as you're helping people re-regulate their circadian rhythm?
So I'm actually doing research in one supplement
Mm-hmm.
that is a form of vitamin B3 that
Oh.
can help the biological clock or the circadian rhythm to work better.
Hmm.
So hopefully we'll have some results for you soon.
Hmm.
So vitamin B3 is important for the biological clock. So the actually brain structure that helps understand when it's daytime, when it's nighttime, and communicates to the rest of the body that is daytime or nighttime, and that's time for this hormone to be regulated or for that function to be working,
Hmm.
right? So I'm working on research for that. But of course, we have magnesium and melatonin that is not a supplement, it's a hormone, but it's sold,
Oh, okay. Okay.
right? Those we have research on melatonin and magnesium that demonstrate that they help
Mm-hmm.
sleeping better, especially for specific conditions. For example, shift workers, if they take
Mm.
melatonin at a specific time, help them sleep better and have a better functioning for their biological clock or their circadian rhythms. What is important to say is that if we go for our day without a set schedule, eating at crazy times, eating
Mm.
unhealthy food, not exercising at all, and then we take a melatonin and expect to fall asleep and stay asleep
Mm.
during the night, is not going to work,
Okay.
right? It's the same thing for other supplements as well. So they're not going to overcome the other components that are missing for the sleep pattern. And that's something that I think that most people will struggle with
Yeah.
because they expect that, okay, I'm going to be in front of my computer for 16 hours and
Right.
I'm going to shut my computer, take a melatonin, I'm going to fall asleep.
Right. Yeah.
And that's not going to happen.
Right, right.
Yeah.
I mean, that makes sense. Yeah. So, one of the questions I want to ask you is just regarding, like, when someone's trying to grow in virtue, they're trying to get all their habits in order, trying to grow in holiness. But I think maybe, I don't know if it's an American thing, but I know, like me and a lot of my friends, we talk about how we feel very selfish when we're trying to prioritize our sleep, when we're trying to prioritize our health. And it feels like we are kind of being self-focused, versus others focused. So I'm wondering, like, what are your thoughts on the connections between, sleep and holiness and self-care, and like when does it really become this self-indulgent thing versus when is it just, being responsible and loving yourself in a proper way?
I love this question because it's something that I try to communicate lately, and it's just um, so difficult in our culture to communicate that
Mm-hmm.
because, as you said, it comes out as being selfish,
Mm-hmm.
right? But if you think if we think about our bodies as temple of the Holy Spirit, we need to be doing the best that we can to take care of this temple, right? And sleep is part of a physiological function that God designed us for, just like breathing.
Right. It's not like a consequence of the fall, like, and now they fall asleep.
Yes. And it's just like breathing, right? It's integrated with our system. And if we are depriving ourselves for something that God designed us for, I think we're going against the holiness of this temple. We're not taking care of the temple as supposed to. Believe that the conflict that we have is that we live in a society that everything is 24/7. Everything's open all the time. Everything is ready to go all the time. Like we order something on Amazon and the next day is in your door.
Right.
So we are pushed to be in the society that everything needs to be fully operating 24/7. But our body is not designed like this. And I love to remind people also that when God finished the creation, he rested.
Yeah.
All day to rest.
Right.
Right. So why we are not doing the same?
Right. Yeah. Oh, yeah. Especially when you look at people who are like Orthodox Jews and the way they keep the Sabbath. I mean, some of them don't even turn a light switch on, you know?
Yes. They are honoring that day that God took to rest to do the same thing for themselves.
Yeah.
And they are honoring God for that. So if we think that we cannot sleep 7 hours a night because we're being selfish by sleeping 7 hours a night, that's a cultural shift that needs to change.
So, I mean, yeah, sleep is obviously biologically necessary. So is food. And yet it's a tradition of the church to fast from food, you know, whether it's just abstaining from meat or more serious fast. Can we fast from sleep? You know, why one and not the other?
And I love this question. And like we see some points in the Bible that Jesus was awake praying, right? And he asked John, Peter, and James to stay awake with them, and they fall asleep. Yeah. And it was huge, this huge thing, like, oh my gosh, you couldn't stay awake and pray with me.
Right.
So kind of puts that pressure on us. I should be sleeping, or should be praying, you know?
Yeah.
But again, thinking about sleep as a physiological function, just like breathing, we cannot stop breathing, right? Without having a consequence.
Right. You can't fast from oxygen.
Yes, like we can fast from food and then we gonna eat and compensate for that.
Yeah.
But we fast for sleep, we have sleep deprivation, period.
Yeah.
You can sleep the next day, but you cannot gain that night that you lost.
Yeah. Well, and I mean, now that intermittent fasting is a really popular health trend, a lot of people, it's interesting. They say they have actually cognitive benefits and anti-aging benefits from fasting, but it seems like the complete opposite when you have sleep deprivation.
Yes, you're actually gonna age faster if you don't sleep well.
Right. Do you think I don't know how to phrase this, but do you think that we have sort of a moral obligation to do these things? I mean, in some ways it's tricky to talk about this because then people can start to get scrupulous and say like, oh no, I'm sinning by like not taking care of my sleep. But do you think there's a moral component to it, if that makes sense?
Yes, that makes sense. And I like to compare this with the life of some saints. Like, for example, Saint Francis de Sales, we know that from his history that he slept 5 hours a night.
Yeah.
Saint John Vianney, he slept 4 hours a night. Right?
Yeah.
We look at them and say, well, I'm sleeping 8 hours.
Right.
I'm not going to become a saint, right? So I wanted to remind from a scientific standpoint that some people are short sleepers, that their physiology is different, that they can function well and have the same benefits with less time. But that is a very small fraction of the population, right? We are more likely to be like Saint Teresa of Lisieux, that she would try to to meditate and fall asleep through it,
Yeah.
we are more likely to be like her,
Right, right.
right? Santa rest. So like I would say is our moral obligation to take care of the temple that we have, that is our body, because the Holy Spirit lives on it.
Yeah.
So think about how Jesus got into the synagogue and start throwing people away that they were not respecting the temple.
Right, right.
And it was just a physical temple. Imagine our body that the Holy Spirit is dwelling with us all the time. We have the moral obligation to eat well, to exercise, to keep this temple working, and sleeping is part of that.
Right, yeah. Well, and it's funny because you mentioned the story of in the garden where Jesus is awake praying, the disciples are falling asleep, but we see the reverse of it earlier on when Jesus is sleeping in the boat and the disciples are all awake and they're like,
Yes.
"What are you doing?" You know?
Yes, yes. So we need to have the discernment to understand when it's appropriate to fast for that,
Mm,
and to stay awake in prayer, right?
yeah,
We need to understand when Jesus is calling us to do that.
right.
In the boat, he was not calling for that.
Right,
Yeah.
right.
Despite of the storm that was going on and how much frightened they were, fearing for their lives, Jesus was not calling for that. He was calling for calmness and relaxation
Mm,
because he was taking care of everything.
mm, yeah.
And in the garden, he knows that death was imminent and he knows what he's going to go through. So he was calling for prayer at that moment. So we need to be open for to understand the difference of in those times,
Right.
in the in seasons that we go through our lives too, and make sure that we are listening to God's call and following it.
Right, right. I mean, that makes sense. You know, I mean, yeah, if your kid comes in the middle of the night and they're sick, you know, you're not gonna say, "Well, I got to get my 8 hours, like go back to
Exactly.
bed."
Exactly. So it's a different call, it's a different season. And I really appreciate how many times in the Bible Jesus communicates and God communicates with us through a dream.
Yeah,
So,
that's so true. Yeah, you're
yeah.
right.
So if it wasn't something important, we are not be sleeping. It just
Right.
it's so random, right?
That's so true. I never put that together, but I mean, yeah, there it just shows how it's a God ordained thing, you know?
Yes. Yes. That's how I like to see it.
That's beautiful. Okay, I think that's the perfect way to end this. Dr. Weiss, thank you so much for taking the time to chat with me and answer all of my questions. I know that my listeners are going to love this. Um, if they want to follow you or follow your work, where can they get in touch with you?
Thank you so much, Mary Rose. This was a great conversation. I feel very inspired to talk about faith in sleep.
Yeah, yeah,
I not always have this opportunity, so I appreciate your invitation.
absolutely.
And for anybody that wants to know more about sleep, they can follow me on Instagram at Dr. Wise Sleep Education.
Okay. Fantastic. All right. Well, have a wonderful rest of your day. And I hope you have a restful night's sleep too.
Thank you. Same to you.
All right. God bless.